Happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick, emergency medicine, coming to you from my quarantine room.
Yes, my friend, my love. How are you feeling?
Doing good. I did test positive for COVID infection on Wednesday of this week. Been feeling a little just kind of achy. Back is a little sore, arms are a little sore, maybe a little dry cough, but overall feel pretty good. Just frustrated. You know, it's honest to say that like being confined to one room in this house for 10 days for the quarantine period is going to be, boring to say the least. And I'm relying a lot on Amy and the kids to, take care of me and make sure I'm fed throughout this whole ordeal.
Well, we're happy to do it. We quarantine started Wednesday, so the kids and I are on a quarantine for a 2-week period. And basically, today I wanted to talk about number one, kind of what you do when you find out that you're infected with the novel coronavirus, and also what do you do as a close contact. And we've been over it briefly before, and certainly now that we're going through it personally, I felt like it was only a matter of time, right, Bri? I mean, for sort of the risk exposure you have in the ER, I think also, it's been a long time, so people may, you sort of get a little bit, you maybe let your guard down, or I don't know if the patients are cohorted as much, who knows? But it was only a matter of time before you got exposed.
Yeah, I mean, I'll tell you, when this first really started in February, March, we had kind of sit down discussion about what would happen if I got sick or if you got sick, and how would we manage it and who would take care of the kids and so forth. And so, it's here now. And I think it was really just a matter of time, given my profession working in the emergency department. I've been very good with wearing my PPE throughout the whole ordeal. I mean, I wear a surgical mask throughout my whole shift, and I wear an N95 mask when I'm in contact with patients who are potential COVID infected patients. And so, we did everything we could to take proper precautions, and just, I got it. I don't know if I got it on shift or if I got it out in the community somehow, but it was of no fault of my own, because I've done everything I can to protect myself. But now we have to say, like, going forward, how do I protect you and how do I protect the kids? And then until I'm not infectious anymore.
Right, exactly. So that's why you're on a 10-day isolation. So you're, and then that basically, once that isolation is done, then you can come back in contact with us. We have to stay quarantined to allow, basically the full course of the incubation period for the virus to either develop symptoms. So that's a 14-day quarantine from the point of last contact. So we're looking at doing this for another couple of weeks. But that's all good, as long as we stay mentally tough. What you do if you find out if you have coronavirus, the novel coronavirus, COVID-19, there's been a lot of back and forth about outpatient treatment protocols. I think the number one thing that I've been doing for all of my patients, regardless of age, and certainly more so for older people, but is just checking their vitals and making sure that their oxygen level is okay. Because sometimes it's kind of, they've talked a lot about, the happy hypoxemia. So there's patients that they're not even in respiratory distress necessarily, but their oxygen level tends to float down, right?
Let's do a live check of my heart rate level right now.
So you may not know it. So that's kind of what I've been doing intermittently. And I even recommend my patients buying one to have at home in case anybody at their house falls sick. So we've been doing that for you.
97% oxygen saturation and 60 resting heart rate, which is excellent if I do say so myself.
Very good. Very good. We've been doing that. We also started you on some zinc. Zinc has been shown in actually other studies to shorten the duration of cold symptoms sometimes. So that's kind of the only supplement that's really been shown to be helpful. So we started you on 200 milligrams of zinc.
When it comes down to the risk benefit ratio is something we talk about a lot. I mean, the benefits of zinc maybe shorten the duration, but the risks of taking zinc fairly low.
Right, water soluble, you just pee it out basically if your body doesn't use it. So we started you on that. We did not start you on any sort of hydroxychloroquine or azithromycin, as that evidence is very limited and potentially could even be harmful. So, and then you treat it really supportively through like any other cold or flu virus. So lots of fluids, lots of electrolytes, because your body's kind of working overtime to kind of fight off the infection. So you could be a little bit depleted in potassium, magnesium,
I've been drinking Gatorade
phosphorus.
Zero. We're not sponsored by Gatorade, but Gatorade, if you want to reach out.
Chicken broth, all that good stuff. And then what do you do if you find out you've been, and then the other thing you should do actually, if you've decided, if you've been told you have it, is really trying to reach out to your close contacts, trace back your steps, 48 hours. That's the recommendation from the CDC, 48 hours from symptom onset. So for Brian, he started feeling sicker on Tuesday. So that would have been like Sunday, and Monday would have been the people he was in contact with that we kind of reached out. There's some studies showing that only 50% of people that are diagnosed with COVID ever hear from the health department. It's kind of a big, difficult bureaucratic system. So even though it's a reportable disease, and I did report you, you may not get contacted. Who knows? There are contact tracers out there, and they've been hiring, like crazy in the LA Department of Public Health. But it's our responsibility to mitigate that risk as much as possible. So we contacted people we were in contact with 48 hours prior to symptom onset to let them know that they do have to quarantine and eventually get tested during their quarantine duration too. So, and then, the kids and I are basically on quarantine from 2 weeks from Wednesday, and we'll get tested in the interim to see, how we're feeling or what our results are. Our cases.
You tested me on what was it? Tuesday? No,
Wednesday.
And I was positive from the rapid antigen test, which is not a great test, but it's a decent screening test. And then you also tested the PCR test that same day, which was 2 days to come back, and that came back positive as well.
Right, so which was consistent. Yeah, and that's reassuring. The rapid antigen tests are 15 minutes. We have those in our office. There's many different varieties of them. They really, even though they're not perfect, they're not as sensitive as the PCR. It does give us better triaging protocols. You were able to write that in there, isolate yourself, where it would have taken you an extra 2 days if we didn't know about the result till today. So shaved off a couple of days from the quarantine. We were able to let people know earlier. So the sensitivity usually with symptoms. So I recommend people with symptoms getting rapid. If it's not a great screening test, it's okay. But with symptoms, can be anywhere in the high 80s, low 90%. Specificity is excellent, like high 90s. So there aren't a lot of cross reactivity with other coronaviruses with these rapid antigen tests, which is good. So we were worried about, is it a false positive? And it wasn't, because it was confirmed by the PCR.
Yeah. And, again, just to, let everybody know, I feel okay. I'm not having any trouble breathing. My oxygen saturation is 97%, which is really normal. Anything really over 90%, I'd be okay with. Once in the ER, we see somebody that's 89% or lower, that's when we really start to worry. But yeah, I feel pretty good. I've never had fevers throughout this whole course so far. And the muscle aches that I have, which is kind of my biggest complaint, is usually treated pretty easily with ibuprofen. I'm taking 600 milligrams ibuprofen every 8 to 12 hours or so. And
right.
That's really making me feel a lot better. So just trying to stay busy. My son built me a little miniature golf course, Halloween theme. That's Stellington there at the back. So I'm going to try to get some putting in, and just trying to kind of ride this out until I guess my quarantine ends on November 7th.
Right. And we are seeing an uptick in cases in our county. Hospitalizations are still staying pretty steady, and our death fatality rate is also pretty low. So if you look at the demographics of people getting it, it is young, healthier people, and they're faring better. But what it does tell us is that community transmission is going up. So wearing your mask absolutely everywhere you go, so that you can potentially, if you do get it, not only will you reduce your chances of getting it, but it may reduce the severity of illness. There's literature to support when you wear a mask, you are preventing at least the amount of viral load that's entering your system. So you're more likely to get a more mild case. So there's a lot of reasons. And the last thing I'll say, I'll put a big plug in for the flu shot. We really need a really great sort of uptick or uptake in flu vaccinations this season to help really reduce the amount of flu we see this season. We don't want to outstrip our resources, but there's also some early literature showing that possibly that it creates a sort of immunogenicity response that may protect you from actually contracting COVID too. Sort of
Didn't
like
help me because I had my flu shot already and I
it
still.
didn't, but it's like probably for the first few weeks, and it may not be. Yeah, you got it early, but just something to think about. We're here for you. Healthandhealingdpc.com, 818-600-2426. We'll take good care of you, Bri.
Thanks for taking care of me, Dr. Ostick, and kids. And yeah, we'll see you on the next video. Hopefully it'll be next Friday and I'll be right at the end of my quarantine.
That's right. All right. Bye.
Bye.
Bye.